Hi, and welcome to the seventh presentation in a 10-part series, Medication Class, The Pivot Perspective. Here's a necessary legal disclaimer. Dietary supplements are not evaluated by the FDA and are not intended to diagnose, treat, cure, or prevent any disease. Always consult with your own healthcare provider before changing any of your medications or starting a dietary supplement. This presentation and the other information on my website are for information and educational purposes and should be independently verified and assessed before making any personal healthcare decisions. Hello, my name is Dr. Amy Nabarick. I am the founder and CEO of Pivot Integrative Consulting. I'm a doctor of pharmacy with over 20 years of experience in community pharmacy practice. As an integrative pharmacy specialist, I empower my clients to discover root causes for chronic conditions and improve gut health using functional medicine, integrative pharmacy, and nutrition recommendations. I believe in food as medicine to heal the gut and provide better overall health and wellness. Today, we are going to talk about hormonal therapy and micronutrient depletions. The focus for this presentation is on oral contraceptives and hormonal replacement therapy, so this topic will be focused on female hormones. Sorry, guys, but feel free to stay tuned. You might learn some things to share with the women in your life. Our objectives today are to answer the following questions. What are hormones? What are normal hormone levels? What are some hormonal therapies used for contraception and replacement therapy? What are some side effects from those hormonal therapies? What micronutrients are depleted by hormonal therapy? And how can Pivot help you with your health and wellness goals? Let's talk a little bit about our hormones. Hormones are hard to define, even by the experts. They are signaling molecules that are traveling around the body in the bloodstream that act on certain cellular functions in the body to cause changes in those functions like metabolism, growth, and reproduction. For the purposes of this discussion, we will focus on some of the steroid hormones, as well as two of the peptide hormones. Steroid hormones have these ring-like structures and are created from cholesterol molecules. They are lipophilic or fat-loving, so they can easily cross the cell membranes. Steroid hormones include estrogens, progesterone, and testosterone. Yes, even women have small amounts of testosterone. The two peptide hormones we'll look at are the follicle stimulating hormone, or FSH, and the luteinizing hormone, or LH. These are responsible for the development of the follicle released by the ovaries during ovulation. FSH and LH are released by the pituitary gland, and that is responsible for signaling ovulation, which is the release of a mature follicle or egg from the ovary. Then we have our estrogens. Those include E1, which is estrone, E2, which is estradiol, and E3, which is estriol. Now, E3 is the primary estrogen in pregnancy. The others are released from the ovaries as well as adipose tissue, that's our fat cells. And because our fat cells also release estrogens, women who are overweight or obese most likely have an imbalance of their hormone levels and can become estrogen dominant. This can set you up for a host of other issues. I will discuss this more in another presentation, and I have blog articles on this topic if you would like to know more. Okay, so estrogens signal the growth of the uterine lining. Progesterone is released from the ovaries and helps to support a healthy pregnancy. Since progesterone and cortisol are made from the same precursor molecule, women who are under a lot of stress may make more cortisol than progesterone. So low progesterone levels can also lead to a dominance in estrogen. Low levels of testosterone are also produced by the ovaries and are necessary for the follicle development and a healthy libido. Women who have higher testosterone levels or aldosterone levels often have fertility issues, hormonal changes, and polycystic ovarian syndrome. That's where there are many fluid-filled cysts that form in the ovaries. Here is a common graphic that we can see depicting a typical woman's menstrual cycle. Of course, every woman is different, so certain phases may be longer or shorter depending on your own unique genetics, as well as environmental factors. However, in a typical menstrual cycle, you see at the start of the cycle, the ovary starts to ready a follicle or an egg for maturity and release, and the uterine lining is thickened. We see a spike in estrogen, followed by a spike in progesterone and FSH and LH. This signals ovulation. Then the progesterone levels increase to support a healthy pregnancy if fertilization occurs. If the follicle is not fertilized, progesterone levels decline and the uterine lining is shed as our monthly bleeding cycle. Because this is a cycle that changes depending on the time of the month, whether the woman is pre or postmenopausal, and is unique to each woman, it is hard to have a set range that these levels are supposed to be. It is important if your primary care provider has performed labs on your hormone levels that they know where you are in your cycle to be able to tell if these levels are in balance or not. This chart provides the recommended levels at each stage of a woman's cycle. Like everything, it is all about balance and ratios. Okay, so let's talk about some oral contraceptives. Birth control has evolved from early methods using acacia leaves, honey, and lint to form a cervical cap to modern day hormonal tablets, patches, vaginal rings, and intrauterine devices. I will focus on the oral contraceptive tablets for this presentation, but some of the other forms of birth control can also affect micronutrients and have their own pros and cons. Birth control pills prevent pregnancy by stopping the ovaries from releasing the eggs, thinning the uterine wall lining, and thickening the cervical mucus, which keeps sperm from fertilizing the egg if it is released. Birth control pills come in two forms. We have the combination tablets that contain progestin and estrogen hormones in different ratios, as well as the mini pills, which are progestin only. Some packs contain only 21 tablets of active hormones, and some have an additional placebo or iron tablets. Season Eat contains 91 days of hormones, so someone on that birth control would only have a period 4 times a year. The important thing to know about the mini pills is that they must be taken at the same time every day to be effective. These are typically used for women who can't take estrogen, women who are prone to blood clots, or women who are breastfeeding. Side effects of birth control pills include breakthrough bleeding, which is separate from the normal menstrual period, nausea, breast tenderness, hormonal headaches, weight gain, which is usually due to fluid retention, blood clots, and mood changes. Many of these side effects can be linked to the micronutrient depletions that birth control pills can cause, but some are also related to overall gut health and the microbiome. This is especially true with mood changes. Did you know that 90 to 95% of our body's serotonin, which is important for our mood, is in the gut? Since birth control can cause changes to our microbiome and the kinds of beneficial organisms that are in our gut, it's no wonder that women on birth control find themselves depressed and anxious. Okay, so let's talk about hormone therapies used after menopause. Many women are given hormone replacement therapy to help with the symptoms of menopause, like night sweats, hot flashes, decreased libido, and vaginal dryness that occur as the body decreases hormone production. There was a time when every woman was put on hormone replacement therapy that usually consists of conjugated estrogens, Premarin, or progesterone capsules. There are also patches, creams, and bioidentical hormone therapies that can be made at a compounding pharmacy. Women who need hormone replacement therapy and have an intact uterus need progesterone due to the risk of uterine cancer with estrogen alone. Remember that estrogen stimulates growth of the uterine lining. It was assumed, however, that women who had a hysterectomy, which is the removal of our reproductive organs, would not need progesterone, but recent studies have indicated that this is not the case. Even women who have undergone a hysterectomy still need progesterone to balance the estrogen for other bodily functions. And progesterone can help with sleep, mood, and reduce breast cancer risk. Side effects from hormone replacement therapy are the same as oral contraceptives and includes abnormal uterine bleeding, fluid retention, breast tenderness, headaches, and mood changes. Hormone therapies can lead to many micronutrient depletions, and many of these can cause or worsen the side effects seen on the previous slides. As you can see, hormonal therapy can deplete many different micronutrients, as well as the gut microbiome. B vitamins like folate, B1, B2, B3, B6, and B12 are important for energy production in our cells. Vitamins C and E and the mineral zinc help our immune function. Calcium and magnesium are good for our bones. So depleting these micronutrients can have major consequences. Folate is key to healthy cell growth and function, the making of DNA and RNA, and is necessary for the formation of red blood cells. Folate is also part of the methylation pathway, which assists the body with detoxification. Folate also reduces the risk for birth defects and preterm birth. A folate deficiency can also show up as anemia with weakness and fatigue, difficulty concentrating, irritability, and headaches. A person with a folate deficiency may also have mouth or tongue sores and changes in skin, hair, or fingernail pigmentation. As mentioned previously, folate is part of the methylation pathway, which is part of the body's detoxification process. And there is higher risk for neural tube birth defects like spina bifida in women of childbearing age if they do not have enough folate. Some foods that are good sources of folate include legumes, or beans, peas, and lentils, nuts like almonds and walnuts, asparagus, eggs, leafy greens, citrus fruits, and the brassica family like broccoli and Brussels sprouts. Vitamin B1 is also known as thiamine. Thiamine is important for energy metabolism, so growth, development, and function of cells. It is a cofactor for glucose, amino acid, and lipid metabolism. Without it, our bodies cannot break down the components of our food. Some bacteria in our gut can make thiamine, so our gut health is also so important for these B vitamins. Thiamine deficiency can cause weight loss, confusion, short-term memory loss, muscle weakness, and an enlarged heart. Severe thiamine deficiency is also called beriberi, which is usually diagnosed when the person presents with severe nerve damage and wasting. Many foods in the U.S. are fortified with thiamine, so we can usually get enough in our diet. Some foods that are naturally good sources of thiamine include pork, black beans, seafood like mussels, trout, and tuna, acorn squash, and sunflower seeds. Vitamin B2 is also known as riboflavin. This B vitamin is also important for energy production in our cells and the breakdown of fats, drugs, and steroids in our body. Bacteria in our gut can make riboflavin and produce more with a vegetable-based diet versus a meat-based diet. Riboflavin deficiency is rare in the United States, since so many of our foods are fortified with B vitamins. However, low vitamin B2 levels can cause skin disorders, mouth or throat swelling, sore throat, cracked lips and sores at the corners of the mouth, hair loss, and reproductive problems. If the B2 deficiency is severe, it can cause nerve and liver damage. Some good sources of riboflavin include beef liver, dairy products like yogurt, cheese, and milk, clams, almonds, mushrooms, quinoa, and eggs. Here we have vitamin B3, also known as niacin. Like the other B vitamins, niacin is important for energy production in our cells. It also helps with cellular communication, how our genes express themselves, making cholesterol and fatty acids, and can function as an antioxidant. Niacin is sometimes used to help people balance their cholesterol. One effect of niacin is skin flushing, like a hot flash. A severe niacin deficiency is also known as pellagra. Low niacin levels can cause rough skin that turns red or brown in the sun, GI issues like vomiting, constipation, or diarrhea, depression, headaches, extreme fatigue, aggressive or paranoid behavior, and a bright red tongue. Foods that are a good source of niacin include beef liver, other meats like chicken, turkey, pork, and beef, salmon, brown rice, seeds like pumpkin or sunflower seeds, and lentils. Okay, let's look at vitamin B6, otherwise known as pyridoxine. Vitamin B6 is essential for protein metabolism, cardiovascular health, cognitive function, and immune function. People with a vitamin B6 deficiency can have a microcytic anemia, which means the red blood cells are undersized. It can cause skin conditions, depression, confusion, and decreased immune function. Some food sources of vitamin B6 include fish, organ meats, potatoes, chickpeas, avocado, sweet potatoes, bananas, and sunflower seeds. Okay, vitamin B12 is necessary for nerve and brain health, blood cell formation, bone health, and insulin sensitivity. Some signs and symptoms of a vitamin B12 deficiency includes megaloblastic anemia, which is abnormally large red blood cells. And that can present as fatigue, pale skin, and weight loss. It can also cause heart palpitations, dementia, infertility, numbness in the hands and feet, and that can mimic peripheral neuropathy and diabetes. Some food sources of vitamin B12 include organ meats, beef, clams, fish like tuna and salmon, eggs, and dairy like milk, yogurt, and cheese. Sometimes a supplement is still necessary to achieve optimal levels. Some of the functions of vitamin C include antioxidant and anti-inflammatory properties. It supports immune health, regulates gene expression, improves absorption of iron, and is necessary for collagen formation, supports skin, bone, and muscle health, and supports wound healing. A vitamin C deficiency is also known as scurvy. Some signs of scurvy include poor appetite and growth, impaired wound healing, painful swollen gums and tooth loss, impaired immunity, pain in the extremities and skeletal muscle atrophy, and an increase in capillary fragility and bruising. Food sources for vitamin C include rose hips, guava, strawberries, citrus fruits, sweet peppers, parsley, kale, and broccoli. It is best to find fresh local produce when you can, because vitamin C is fragile and starts to degrade right after picking. It can lose up to 50% of vitamin C content within a few days to a few months, depending on the food and storage conditions. And more is lost with cooking, especially boiling. Vitamin E is used to describe 8 fat-soluble chemicals known as tocopherols. But alpha tocopherol is the only recognized form that meets human requirements. Vitamin E works as an antioxidant to help protect our cells from free radical damage. Vitamin E helps to boost our immune system and opens blood vessels to reduce blood clots. Our digestive tract requires fat to absorb vitamin E from our foods. So people with gut dysfunction, gallbladder issues, or low-fat diets may not have enough vitamin E. A vitamin E deficiency can cause nerve damage, muscle weakness, vision problems, and a weakened immune system. Sunflower seeds, nuts like almonds and hazelnuts, peanuts and peanut butter, spinach, broccoli, and kiwi are good sources of vitamin E. Okay, calcium is important for bone health, muscle health, blood clotting, nerve function, and thyroid function. Taking calcium with vitamin D helps to increase its absorption. A calcium deficiency can cause osteoporosis and brittle bones, poor dental health, cataracts, muscle cramps, weak and brittle nails, inflamed, itchy, dry skin, and hair loss. Some foods that contain calcium include dairy products like yogurt, cheese, and milk, but there are non dairy sources as well. Leafy greens, tofu, and soybeans, fish that contain small bones like sardines or salmon, figs, and seeds like chia seeds also contain significant amounts of calcium. Enzyme Q10 is important for producing energy in our cells. Our cells' mitochondria need CoQ10 for energy production. It also plays a significant role in immune health, functions as an antioxidant to protect our cells from free radical damage, and it even has been shown to recycle and regenerate other antioxidants in the body. Muscle weakness, weakened immune function, difficulty concentrating, mood changes, and headaches are common symptoms of coenzyme Q10 deficiency. Foods are not the best sources of CoQ10, so a supplement may be necessary if your levels are really low. For instance, you may take multiple medications that deplete CoQ10. However, there are some foods that can help boost your levels. Organ meats like liver and heart, beef, fatty fish like salmon, tuna, sardines, and mackerel, sesame oil, spinach, azuki beans, and broccoli. Magnesium is important for energy production, converting our food to energy. Magnesium helps with muscle contraction and relaxation, helps regulate neurotransmitters that send messages throughout the brain and the body, and also helps to form our genetic material, DNA and RNA. Magnesium can regulate calcium to support our bone structure. Magnesium deficiency may appear as fatigue, weakness, and loss of appetite, as well as nausea and vomiting. Someone with magnesium deficiency may also experience muscle spasms or stiffness. Low magnesium levels may lead to an increase in blood pressure or blood glucose levels, brittle bones, and osteoporosis, as well as worsening migraine symptoms. Nuts and seeds like almonds, cashews, flaxseed, and pumpkin seeds are good sources of magnesium. Legumes like black beans, edamame, peanuts, and lima beans contain magnesium. Quinoa, spinach, and dark chocolate also contain magnesium. In fact, if you find yourself craving chocolate, you may be low in magnesium. Here we have selenium. Selenium is essential for reproduction, thyroid hormone production, DNA synthesis, and has antioxidant properties. Remember, those antioxidants help to protect our cells from free radical damage and premature aging. Kids consume an adequate amount of selenium. However, a selenium deficiency combined with a trigger like a viral infection can lead to something called Keshan disease, which is a disease that can affect heart health. A selenium deficiency is also linked to infertility, muscle weakness, fatigue, brain fog, hair loss, and a weakened immune system. Some foods that contain selenium include Brazil nuts, fish and seafood like tuna, halibut, sardines, and shrimp, meats like beef, ham, turkey, and chicken, cottage cheese, eggs, and brown rice. Here's zinc. Zinc is essential for immune function, wound healing, growth and development, especially in children, gene expression, and making DNA and proteins. A zinc deficiency can cause an increased risk of infections, slow growth and development, birth complications, diarrhea, changes in taste and smell, and delayed wound healing. Some foods containing zinc are seafood like shrimp, crab, and oysters. In fact, oysters have almost 3 times the recommended amount of zinc. Other foods include meats like beef, turkey, and pork, pumpkin seeds, cheese, lentils, and sardines. Okay, here we have tyrosine. It's an amino acid which is a building block of our proteins that are used to make dopamine, epinephrine, and norepinephrine. Those are important neurotransmitters for our brain. Dopamine regulates the reward and pleasure centers in the brain. It's also important for memory. Epinephrine and norepinephrine are part of the flight or fight response. Tyrosine is also used to produce thyroid hormones and melanin, which gives our skin and hair and eyes their color. Low tyrosine levels can lead to low blood pressure, low body temperature, mood changes, concentration issues, and difficulty managing stress. Caution is advised in supplementing tyrosine, especially in older populations. Always consult your healthcare provider before starting this or any other supplement. Many fermented and aged products contain tyrosine. Foods like soybeans, tofu, and soy milk, cheese, fish and meat, including chicken, turkey, and pork, eggs, and seeds like pumpkin seeds and sesame seeds, as well as beans, contain tyrosine. So, if you take birth control or hormone replacement therapy, I do recommend at least testing levels of some of these micronutrients, especially if you're having any of the symptoms that I listed. I recommend checking and optimizing your vitamin D levels, taking a probiotic for gut health, a B complex to replenish those lost B vitamins, possibly taking calcium and magnesium to reduce bone loss, and then vitamin C and zinc when you feel like you're getting sick to support your immune health. Of course, check with your healthcare provider before starting any supplement or discontinuing any kind of medications. Here's my list of references for this presentation. So, how can Pivot Integrative Consulting support your health goals? Let me tell you a little bit about what we offer. We offer concierge consulting services. You can take a deep dive into your health with a comprehensive personalized consultation with an integrative pharmacy specialist. Our recommended programs are typically 6 months long and include one-on-one sessions, lab testing and reviews, and nutrition and supplement recommendations. We take the time to listen to you and your needs and develop a plan that works for you and your goals. Are you ready to pivot to functional health and wellness? Is this your year to discover underlying causes of disease and feel your best? Contact me today for a free 10-minute connection call. Info at dramyknaprek.com. That's info at dramyknaprek.com. Feel free to contact me at info at dramyknaprek.com for a free 10-minute connection call, or if you have any questions about this or any of my presentations. Also check out www.dramyknaprek.com for more presentations and articles about health and wellness. Thank you for being here today.